there's a lot of things that are involved, but we need to have these basic needs met. And if we're not, then we're going to be even more stressed. It's going to heighten our stress. And after a while, if you're going through that a lot, what happens is eventually you start to end up with a condition known as adrenal fatigue or adrenal weakness. There can even be an extreme to that known as adrenal exhaustion. And it's kind of like a well, you know. I'll give you an analogy. You have a well, you fill up the well, all is plentiful, all is good, right? When that well is full, you have a resource. You have that fresh underground water that you can use for your household or whatever it's used for. But it's a full reservoir. So we have a full reservoir. And generally speaking, if we haven't gone through a stressful birthing, we're born with it, right? So we have this full well, this reservoir, and that reservoir is used a little bit as we go through individual stressors in our lives. And so we're basically having an outflow from the well to supply our needs in response to stressors. And then our body kind of replenishes that, re-energizes, rebuilds through sleep, through restfulness, through mindfulness, perhaps if you're practicing meditation, yoga, things like that. You can help to replenish that well. Even just practicing, frankly, cognitive practices like cognitive behavioral therapy or cognitive self-analysis, or even perhaps rational emotive therapy or rational self-analysis, looking at yourself and your thoughts and saying, okay, maybe I'm not thinking right here, you know, maybe there's a better way to look at this. Maybe things aren't quite as bad as they appear. And I think sometimes we get ourselves going, like if you're in traffic and it's really intense and difficult traffic, and you find yourself really frustrated, say you're in a hurry to get somewhere, and you know, and you have somebody in front of you, or maybe lanes in front of you where people are moving very slowly. Perhaps there's some obstacle in the road up ahead or an accident or something like that. But we can get very frustrated with these things, and that can be a source of our stress as well. Simply driving around and getting from here to there can be stressful. So there are coping mechanisms. We can learn to cope with those stressors and maybe have more of a positive attitude, even have a totally positive attitude about it. You know, really looking at it from the point of view of, all right, too bad these people are having a rough day, you know. They're having a hard time getting through all this, and I'm just going to kind of sit back and watch the show, and, you know, it's going to take what it takes. I may not get there exactly when I was hoping to get there, or maybe it's an urgent thing, and I'm just going to have to apologize for it just as a condition of related to the traffic, or maybe we could look at it from the point of view of, well, I could have left a little earlier. Maybe I should remember that for next time. Or, you know, maybe the conditions were unexpected, but I need to plan around these things, this kind of thought. So we can help ourselves through those times with these kinds of insights. And these kinds of stressors can affect our basic need levels in the sense that we feel like our needs aren't getting met. We may even catastrophize, you know, oh no, I'm not going to make the meeting, I'm going to lose my job, or I'm going to I'm going to lose this opportunity, or I'm not going to get to do what I needed to do or wanted to do, or something along those lines, you know. And all of those messages to yourself don't help the situation. They actually harm the situation. They actually make it worse for you. You actually experience more stress. So all of this negative self-talk can certainly add to the issues. And part of what you tap into there is your physiological and safety needs, you know, especially if you're trying to drive to make up for the time and you're driving radically. You're certainly, you know, potentially affecting your own safety and that of others. But we're looking at also the needs, like, oh, you know, I'm going to lose my job, that one. Okay, so if you lose your job, you're going to be losing that, the monetary aspect of that. You're going to lose perhaps some prestige or some camaraderie, or some, you know, you may not be around the same people, these kinds of things. So actually that's 3 different levels of Maslow's hierarchy of needs. That's the physiological needs, you know, being able to feed yourself, the safety needs, and social needs. So physiological, safety, and social needs. And you're giving yourselves messages that exacerbate those issues, that make those needs more of an issue, and, you know, enhance the effect negatively of the stress. And then what you're doing there is you're draining that well. So you're continuing to drain that well, but when you're under those situations, you're draining it at a much faster rate. And so your body has difficulty keeping up with all that and may not be able to meet the need of replenishing that well as quickly as you're draining it. And if you're under these kinds of situations long term, you end up bringing that well down to the bottom, and then your body's trying to recover, but it's just too much. And that is a condition of adrenal weakness or adrenal fatigue. And the adrenals have some functionality in our metabolism. They have a lot of functionality in our metabolism. They also replenish certain levels, like, for example, glucocorticoids add to the blood sugar levels. The adrenals also contribute some to the hormonal picture for our bodies, including the presence especially for certain ages or age groups or stage of life in women. You know, estrone produced by the adrenals is the major estrogen for menopausal, postmenopausal women, versus estradiol and estriol, which estradiol is prominent during the menstrual years. But another one that's very important is progesterone. And progesterone is affected by the presence of cortisol, which is produced by the adrenals as well. And they are molecularly very similar. They're all steroids, essentially. And they're all derived from cholesterol. And this is where the sterol or steroid end of it comes from. So the functionality of the adrenals affects hormonal balance. And this is one of the aspects that I deal with which we've been doing a lot of fertility work. In fact, I have quite a few fertility patients now. We had a Channel 10 spot about a year ago, maybe a little less than a year ago. And maybe more like 6 months ago. And it was a great spot. And it kind of highlighted some of the approaches that we're taking at A Path to Wellness to address fertility issues, and how conventional medicine approaches it, primarily using IVF and other techniques that are related to these kinds of invasive procedures, and then the use of drugs such as Clomid and others that can strongly affect hormonal balance, and that can even stress the body of a woman who may be subjected to those treatments. And they also don't have the greatest success rates. So we're looking at typically fees associated with those kinds of procedures up in the tens to 20s to even beyond that, of thousands of dollars for one procedure, one time. And with the natural approach, it's a fraction of that, all told, for the entire period that it might take to become pregnant. It's a much more body-friendly approach, working with the body, working with the individual's hormones, simply making adjustments and helping to bring everything into balance. And, we've had a lot of success at doing this kind of work. In fact, we've been hitting very high from the 80s to 100% success rate. So very high success rate. And this is much, much better success rate than IVF or any of the other procedures involved. So obviously there's something to what we're doing. And it has to do with understanding the body and how it works, working with the body, working with the hormones, working with the individual's issues in their lives, working with them to address their stressors, these kinds of things. And it's a very, very gratifying thing to see people go through this. And, I get a lot of pleasure and also just a lot of personal satisfaction, especially I've had a few kids named after me and things like that. It's just an awesome experience. It's a great experience. So I really take a lot of pleasure from that. I really enjoy doing this kind of work and helping couples who've been struggling for, in a lot of cases, years, many years, trying to have a baby and haven't had great success, have been having a rough time, maybe even had some miscarriages or other issues come along, such as ectopic pregnancies and such, that might have made it a difficult path. And there's a lot of emotion that goes with that, a lot of feelings, a lot of the desire to have that child, the desire to have a family, and to enjoy the process that's involved there. And at the same time, the emotions of the frustration of dealing with things when they don't go so well, and then the loss, the grieving when a miscarriage happens. I mean, that's grief. That's the loss of a child, And, especially if they've been going a while, especially if they're into like the second or third trimester, that's horrible at that point. But even earlier, even in the first trimester, there's an accumulation of these feelings occurring, these parental feelings, these motherhood feelings for the woman who is experiencing this growth happening inside her body in the transition. And to lose that child, to lose that birth, is very, very difficult and can be very devastating. And so there's an emotion of grief there. And so, helping people through those things is very gratifying for me. And then just down to the basics of dealing with balancing of the hormones in women and helping women with all sorts of different conditions. It can be anything as simple, say that word, and some may not think so, but irregular cycles, helping to balance those cycles, helping to improve the cycles for a woman, helping to improve that monthly visitor and the regularity of the menstrual cycle, as opposed to having it be erratic or non-existent even. Amenorrhea to menorrhagia to all the different conditions. Menorrhagia being an excessive flow. And there are many other aspects to it, but the conditions can also range into like polycystic ovary syndrome, endometriosis, uterine fibroids, ovarian cysts. All of these things can be dealt with through hormonal balancing. And it's actually quite simple fundamentally. It's just a matter of working with the body, helping to balance the body's responses, and helping to make things more regular, more just more balanced, more comfortable as well. So, we have physiological needs, and in a lot of cases, for women, one of the physiological needs is a need for motherhood, a feeling of a desire for motherhood, feeling of a desire of wanting that child, wanting to nurture that child, needing to nurture that child, wanting to breastfeed, or wanting to bond, or all of these kinds of things that go along with having a child. And so in a sense, those are physiological needs. And my perspective on the psychological aspect of that is that most, if not all, psychological disorders have to do with a physiological cause, an underlying cause that is physiological. It absolutely has to be that, because there is no other answer. I mean, everything we are is energy and biochemical in the sense of our bodies, even our emotions have to do with those things. Now we have a realm beyond that where we get into the mind, body, spirit discussion, and we get into energies that are involved there as well. And so all of this relates to Maslow in the sense that it all wraps into our hierarchy of needs. We have physiological needs, we have safety needs. We may even want to give safety to a child. We want to watch out for that child. We want to care for that child. We want to make sure that that child is safe under every circumstance. It's a key issue in the life of any parent. And the social needs, socializing can be, a matter of being in a group, or socializing, being around people in a party or a gathering of some sort, or being among friends, among people who have similar belief systems, among people who are sharing certain issues, sharing causes, sharing, even addressing certain desires. So some of us do this through religious pathways. Some of us do it through more cause-oriented pathways, such as, those who are involved in animal movements, or those who are involved in issues related to social treatment, like the mistreatment or maltreatment of certain aspects of society, certain factions of society. So all of this is part of our needs system. What I'm talking about there is meeting social needs. So when we get beyond the physiological needs and the safety needs and the social needs, Then we get into aspects of esteem. Again, this is according to Maslow's hierarchy. And there are other models, but I like Maslow. It's missing a little aspect of it, but we'll get to that. But when we get into the esteem area, now we have, I accomplished that. I did that. I feel good about that. These kinds of things. Having accomplished some goal, some task, maybe establishing oneself with a certain rank in some aspect of what we're trying to accomplish. That can be like in the military where they attain new ranks. It can be in a job where you're getting a promotion. It can be in an organization where you are perhaps taking on a role of a vice president or an organizer at some level, and coordinating many aspects of what goes on there, these kinds of things. These are all addressing our esteem needs, but also maybe simply aspects of self-actualization, which is really taking ourselves and putting ourselves into our goals and into our needs and our addressing of all of our needs and wants, and moving forward with them. Accomplishment, perhaps reaching some levels of accomplishment that don't depend on our desire for esteem. We may have attained that very well. We may be addressing those esteem needs in many ways, but have more to do with simply a mission for yourself, something that you have as a goal, something that you aspire to, and then you start to attain. This is part of self-actualization, addressing our needs, our wants, and our desires, and attaining certain goals, and acting upon our mission in life, and this kind of thing. So we have physiological, safety, social, esteem, and self-actualization needs. And then we get beyond that, then we're talking about our interconnection with beyond ourselves and others and our society and even the world and even all of these cultural aspects and so on. There's a connection beyond that. And there may be a commonality beyond that, a connectedness, where we all share a certain energy. We all are tapped into a certain source of that energy. We're all tapped into a common energy source. We're all part of the same universe. We are all sharing this electromagnetic source. We're sharing energies. We're transferring energies from one to another, from each other. And it goes beyond emotional responses with that energy. For example, if you experience an issue of road rage with someone, if somebody, you're driving along and okay, you decide you need to move over and you maybe cut somebody off a little bit and they get all upset and start riding your bumper. And then they, play a little game of coming up to your bumper and then backing off or something like that, trying to intimidate you. Or they drive by you and flip you a finger, an expression to essentially call you a name or label you in some way, because that's how they're coping with what they've experienced, instead of looking at it from a different perspective, from a different model, looking at it as simply everyone trying to cope and trying to deal with what comes at them on a daily basis. All of us walking on the same path, all of us sharing this world, sharing our culture, sharing our country, sharing Earth, sharing our universe. We're all together in this. And there are some very, very bad energies in the world. There are some very, very troublesome things going on in the world. So it makes that kind of difficult sometimes if we turn on the evening news. Some people cope with it by turning off the TV. Some people get rid of their television. Some people don't turn on the news, regardless. Don't want to listen to it. It's a way for some of being able to cope with their own daily life and not get drawn into all these other kinds of issues that we may not have a lot to do with. We may not be involved in these things, yet they can still stir us up. They can still be stressors. So we have many things to deal with on a daily basis. And if we're always feeling pressured, we're always feeling stressed, we're always feeling under the gun, from the moment we wake up till when we go to bed, this kind of condition becomes a serious problem because our bodies are undergoing tremendous stress. And this gets transferred into our daily lives. It may affect our demeanor. It may affect our affect, which essentially means that they may change our personality, characteristics, these kinds of things, in a way that's pretty negative. And yet we can step back and we can say, okay, well, that's just the way things are, and it's just something to deal with, and it'll get resolved after a while, and we move on. So stress in our world, especially in the Western world, the Western society, the US, can be pretty intense. This is true in Canada. It's true all over the world, really. Stress is a big part of daily life for many, if not most, societies. And it's really up to us as individuals to not only take charge of our health, but to take charge of our psychology, to take charge, which is really part of health too. Because health to me is physiological health as well as psychological health. But taking charge of it in the sense of thinking about ourselves, being introspective, trying to understand ourselves, and even how we may come across, and then how that may affect us socially, how it may affect our daily routine or our daily encounters. And try to pull back and go back to the root, because the root of all of that comes to dealing with the stressors. And how we choose to do that affects the outcome. Now, it can also be said that how we see those stressors, how we view the things in our daily lives, how we view those daily encounters, our perspective on those daily encounters, then may affect our reactions and our emotions. So we can tap into that. We can change that. That then, by the way, affects us physiologically, because the stressors, if we're stressing over things, to put it simply, we may be causing our body stress that is unnecessary, and that leads to a lot of different processes that can be problematic. It can lead to inflammatory processes. So we may feel more aches and pains. You know, this is, to me, this is something that clinically I've observed may be rooted in adrenal and stress, maybe issues like fibromyalgia, chronic fatigue syndrome. You know, it's not just the back pains and the headaches and these kinds of things, but these are certainly affected by them. We have stress headaches, right? So we have all of these issues affected by how we, not only what we're exposed to and what stressors we're experiencing, but how we look at those stressors, how we view them, how we view those daily incidents that we encounter, how we cope with that affects us, not just psychologically, but also physically. So, in trying to help people on a personal path to wellness, my approach is to address all of those aspects. Now, I may focus a lot on the physical, the physiological, but I also give part of my focus to other needs, psychological issues, safety issues, stressors. You know, if there may be emotional issues going on, how all of those came about, what the core of them is, where they came from, how an individual is coping with those issues, and how we might improve that approach to improve the outcome, to help somebody be well, to truly put an individual, to truly help ourselves on paths to wellness. We need to understand these aspects of our own selves. We need to understand them at a pretty deep level. And for those who do think deeply about themselves and about all of these issues, it can be a very beneficial result. So, I don't know, maybe I'm waxing a little philosophical here, but basically it's a deep subject, and I may not have gotten into it quite this deeply before, so I'm kind of enjoying my own little rant.
But you know what you're calling a rant, I think a lot of times we don't realize, but if the same way you're interested in it, there's one more person like myself, and if I'm interested, there's two more like myself, and there's three more like, so I'm sure that these words are going to spread around the world, and it's not a rant. Very informative.
Thank you. And where I'm coming from here, there's a lot of different areas of psychology that touch on a lot of this. There are some that are more prevalent nowadays that have really been evolving within the last decade, such as positive psychology. Positive psychology is oriented around positive thinking, looking at things from the perspective that they can improve one's life, looking for quality of life, looking for tranquility, things like that. And not the psychology of old that Freud and Jung got into, where you dig into your family of origin, you dredge through all the bad experiences you had, these kinds of things, digging into where the subconscious or unconscious aspects of some issue that you're having may be rooted. But rather than taking yourself through all that trauma that is inherent in psychoanalysis or psychodynamics, going into more of a realm of positive thought structures, cognitive structures, rational thinking, looking at how rational your ideas may be or your thoughts may be, and truly tapping into those things. Like, for example, there's a term that speaks of or kind of demonstrates irrational thinking. Just one word: ridiculous. That word, in and of itself, one could say, is irrational. Why is that? Okay, so you say, this is ridiculous. I can't believe this traffic, or this is ridiculous. I can't believe this price on this thing. They want this much money for this thing, or it's just ridiculous, What is that? That's saying that something is as it shouldn't be. But in point of fact, it is exactly as it should be, because everything that is how it should be. I mean, it may not be what we desire. That's different. But to say it's ridiculous that it's that way could be seen as inherently irrational. Things are as they are. It is what it is. So we can accept that and live a peaceful life and essentially choose our battles rather than take these minuscule things on that may not even really affect our lives in a lot of cases. Except that if we're addressing them in this way, irrationally, then yes, they'll affect our lives, because we're stressing ourselves over things that may not matter at all. This kind of goes along with just the category of like the sky is falling, Chicken Little, right? Catastrophization, catastrophizing. Something's ridiculous. We can make it into its own catastrophe. We can make it into some huge issue, just convincing ourselves that it's a huge issue. So, or we can find another way. We can say, it is what it is. Accept it as it is. And when we can accept it as it is, one, we can move on beyond that issue. But we are seeing things in a way that allows us to have our own peace, our own centeredness, our own security. Back to the hierarchy of needs. So we feel more secure, we feel more grounded, we feel confident in our life, that we're doing okay, that we don't need to worry about such little things, this kind of thing. So we can look at those kinds of thoughts that affect us when we're under stress. In the moment of being under stress is a perfect time to look at those thoughts, to think about how you're thinking about the stressor, to even think about whether it's really a stressor or whether it's just the way you're looking at it that is stressing you. And with that thought, I think we'll call it a day. So you've been listening to A Path to Wellness on rhinoonair.com, WSPF-DB.com. And I'm Dr. Christopher Jackson, PhD, DO in Florida. Practice is A Path to Wellness. just like the show. And you can reach us if you'd like at 727-329-9637, or you can take a look at our website, www.aptw.net, short for A Path to Wellness. Look forward to talking to you next week.